enjoy weightlifting and CrossFit, but are currently struggling with hip pain every time you're going deep into a squat or a deadlift? Well, I'm Dr. Alex Brown with Boulder Sports Chiropractic, and if you follow along, I'm going to talk about hip impingement, what it is, and how to prevent it so that you can lift without pain. So when it comes to hip impingement, there's two categories that I like to use and kind of describe what's going on. One is going to be a true anatomical hip impingement, where we actually have excessive amount of bone growth in that hip capsule, either on the head of the femur or around the rim of the acetabular, where we're actually getting bone on bone, when we're trying to get into a deep squat and move that hip around. The other one, which is more common, is going to be more of a functional hip impingement, where tissues in the front of the hip are just too tight. So we're getting into tight hip flexors, tight quad muscles, tight ligaments in that hip joint. So for these exercises, we're going to focus on the functional hip impingement, where we can improve that range of motion, allowing us to get into a better squat and better deadlift. So when it comes to a functional hip impingement, it's really common that the tissues on the inside of the groin and the front of the hip are usually the culprits for being too tight. So I'm going to show you a couple exercises that we can do to help mobilize the hip joint using some bands. I'm going to get in a position like this where the band is around my affected hip. We're going to take this leg and put it in front, kind of a 90-90 position. And here, I'm just going to go ahead and kind of sit my weight back, loading my left glute. Now the band is helping to pull my femur or my hip in that position, and this is just going to allow me to get into a little bit better external rotation of this hip. So here I can sit back into it, and then if I need to offload it, take a bit of a break, I can come back up, putting a little bit more weight onto my hands and my knees, and then again, sitting back into it. So another alternative to this, to stretching out the inside, is I want to actually focus on stretching out the front of the hip. Same setup, I don't have to really move the band a whole lot, but I am going to turn my body about 90 degrees. Affected hip still has that band coming up into a 90-90, trying to be really tall. I do like to incorporate a little bit of that pelvic tilt, or like a butt tuck or a tail tuck. That's going to help to open up the tissues in the front side of the hip, as this is pulling my hip backwards. So getting a little bit of the mobilization into that hip again. Another thing you can play around with, same thing, we don't have to move the band, coming up this way from here. Now this is helping to push my femur forward. I still like to do that pelvic tilt, getting a nice stretch in the front of that hip capsule. So another common with hip impingement is that we find athletes have a really hard time externally rotating their hip. When we're internally rotated, it gets even more jammed. So we want to focus on an exercise that helps to open up that hip in that direction. I like to do a little kettlebell weight shift. Now I'm going to start in this position, essentially a 90-degree angle of my turned out foot next to my stacked hip. I can play around with just sort of being neutral with this knee here, kind of like a 90-degree bend. We can play around with it where we actually stretch out a little bit more or closer. It's just going to change where you feel it. I'm going to grab the weight, bring it up to this kind of position here. It is okay to have it low, whatever is comfortable for you. I'm going to go up high, and then I'm going to lean into it. So as I lean into my turned out leg, I'm really trying to make sure that my knee follows my toe. So I don't want my knee to dive in. That's not going to be very good for the knee. We're trying to keep it in line with my hip and my foot. So sinking in, coming back out. And I'm going to repeat this. And if I want to play around with it, I can go a little bit further. Typically, you're going to feel this in the hamstring a little bit more. Or coming back, if I'm going to bring it in close, I feel it a little bit more into like the really little muscles in the front of the groin. You might feel this in the quad too. It is a little bit of an activation exercise here, so if you feel it here, still very common. So if you've tried our home exercises and you're still experiencing discomfort or pain, come on into Boulder Sports Chiropractic and let's get you evaluated. We have a lot of tips and tricks here, lots of tools and techniques that we can use and personalize your care for your hip.